Today we're talking about something that's on every Ohio agency's mind right now, audits. If you've been paying attention to what's happening in Ohio this year, you know the state is not playing around. There are new executive orders, there's an enrollment pause for home health, hospice, waiver, and personal care providers, and the state's auditor just flagged over $1 billion in claims that didn't have proper EBV backup. That's a huge number. So today I want to walk you through the 5 biggest reasons Ohio agencies are getting hit with audits and recoupments right now. This applies whether you run skilled services, non-skilled services, or both. And by the end of this video, you're going to know exactly where to look in your own agency before the state comes looking for you. Let's get into it. Number 1, and this is honestly the big one, missing or insufficient documentation. We've seen audit reports where an agency had services with 0 supporting documentation, none. And we've seen cases where the units billed didn't even match what was written down for the visit. One agency had over 250 services with no documentation at all. Here's the thing, it doesn't matter if your caregivers are doing amazing work out in the field. If the paperwork isn't there, or if it doesn't match the claim, that payment is at risk. Auditors aren't grading on effort, they're grading on documentation. The fix here is simple to say and harder to do consistently. Documentation needs to happen the same day as the visit, not 2 days later from memory. And somebody on your team needs to be checking that documentation against the plan before the claim goes out the door. Number 2, billing before the service plan is actually signed and dated. I pulled an audit report where 220 services were billed before the physician had even signed the plan of care. 35 of those had an undated signature. 25 had no plan of care covering the service at all. Now, if you run home health, this is your physician-signed plan of care. If you run non-skilled or waiver services, this is your service plan or support plan and your prior authorization. Different paperwork, but pretty much the same rule applies. If that authorizing document isn't signed, dated, and on file before the visit happens, your claim doesn't hold up. This is a tough one to catch by hand, especially when you've got a big caseload and things are moving fast. The agencies that stay ahead of it usually follow up on paperwork before they submit claims to make sure this doesn't cause any issues. Number 3, and this one's a big deal right now, EBV data that doesn't match the billed claim. I know we talk about this a lot, but it's definitely worth repeating. Ohio's own auditor found that 56% of Medicaid home care services in 2022 were processed without the electronic visit verification that federal law requires. That's over $1 billion in claims with no matching EBV visit. And here's what's changing. Ohio has rolled out EBV hard edits. That means if your claim doesn't have a matching visit in the state aggregator, it gets denied automatically. This applies to personal care and home health services equally, so it doesn't matter which one you run. The way to stay ahead of this is to have your scheduling, your EBV, and your billing all talking to each other instead of living in 3 different systems. Run a match check regularly instead of waiting to find out from a denial. Number 4, caregiver or clinician credentials that have lapsed. This one comes up over and over in Ohio audit reports. In one, none of the sampled aides had valid first aid certification. 0. Auditors expanded that sample and found the same thing happening across a ton of agencies. In another case, an agency owed almost $141,000 because their aides were working with expired first aid certifications, and it came down to some confusion about when those certifications actually expire. So whether it's first aid and continuing education for your aides or current licensure for your nurses and therapists, the stakes are the same. If the person delivering the service doesn't have a current credential, that service can be deemed ineligible. The whole visit, not just the paperwork. The easiest fix is having one system that tracks every credential and alerts you well before it expires, instead of relying on a spreadsheet or somebody's memory. And number 5, overlapping or duplicate billed service times. There was one case where an agency was paid $7.8 million for almost 150,000 services, but auditors found overlapping build times mixed in with missing documentation and services with no care plan, so all of that money got recouped. And honestly, this pattern shows up a lot. a caregiver being scheduled for 2 visits at one time, a client being billed for services at different locations during the same window. And this is exactly the kind of thing that's easy for a computer to catch, which matters because Ohio has built new analytic tools specifically to look for billing outliers like this. All right, so that's the list. Missing documentation, billing before the plan is signed, EBV mismatches, lapsed credentials, and overlapping service times. If you take one thing away from this video, it should be this. Every single one of these comes down to a gap between what actually happened out in the field and what got documented, authorized, or billed. This is exactly the kind of thing our team at GEO helps agencies stay on top of every day, from documentation checks to EBV matching to credential tracking. If you want a second set of eyes on your billing habits, reach out to us. We'd love to help. Thanks for watching, and we'll see you in the next one.